Montgomery County's numbers, today our case count was 531. This is not a good number. I'll remind people this is about 10 times higher than we were in the lower points in August and late July. So 10 times where we were a few months ago is not where we would like to be. Our test positivity rate is 8.4. That's more than 3 times our lower points. And our cases per 100,000 are 39.1. And that's way more cases than we had earlier on during the year. So despite the presence of the vaccine, the virus is still very much with us. And that's one of the messages we want to emphasize to people is that while we're optimistic, and I share that optimism, we're still in the midst of a major health crisis. It will be a while before there is adequate vaccine supply to actually inoculate the general population. So as important as this is, and as excited as people are, and we are all getting bombarded by, when is my turn? When are you going to get to me? Until we know what the supply is going to be over a period of time longer than 1 week, it's very hard to look out 2, 3, 4 weeks, let alone 2 months, and tell people where we're going to be with certainty. We just know that the availability is increasing and we're going to be able to get more out, and we're prepared to get more out. We also know this virus has created a major economic crisis. It's impacted businesses and families. One thing that we're hoping for from the federal government is a greater willingness to spend the money it takes to make businesses and families whole. I've said this before, I'm going to say it again. Businesses were severely damaged by this pandemic. They didn't do anything wrong. They opened their doors, they wanted to be in business, and the pandemic made it impossible to conduct business as usual. And I'm a believer, and I know there are other people in the federal government who believe that businesses should, to the greatest extent possible, be held harmless. And individuals who can't pay rent because they didn't have jobs to earn money to pay rent should be held harmless to the greatest extent possible. We need to get over this. We need to move to recovery. People continue to need assistance, food and housing, and we need to make sure that, and we're going to continue to lobby the federal government to make sure that that assistance is forthcoming. And amidst all that, like I said, we're in the midst of the same health crisis. So we are going to move and continue to do the things we need to do. But we know that I certainly feel we have a better federal partner and a partner who's going to take the pandemic and how to deal with the pandemic a lot more seriously. So we'll continue to ask people that, number one, wear our masks. Please continue to be physically distant. Wash our hands frequently and get tested. We are continuing to test at a very, very high volume. And we're asking people to, please go out and get tested. Montgomery County has tested 536,000 individuals, 51% of our population. Our daily testing volume averaging is looks like about 8,000. And our total testing volume is 1,083,000 people. That's how many people have been tested. That accounts for people who are getting multiply tested because they're in jobs where we need to make sure that when you come back to work, that you're safe. Remember that getting a clean test is not like getting a passport for the next 6 months. A clean test is only as good as your next encounter with somebody who has COVID. So we continue to, have people in high exposure positions continue to get tested so we can make sure that if they do get infected, they're not out spreading the disease in the community. We are really doing everything we can do to knock down community transmission. So with that, I will turn this over to Dr. Stoddard.
County Executive Elrich, and thank you all for being with us again. A couple points I want to make before we get to the, I think the more substantive conversation will be around the vaccination efforts. Our enforcement, as County Executive alluded to, we're still incredibly concerned about the numbers. both in terms of what we are seeing in terms of cases, but also some of the metrics we're seeing from the larger healthcare system. I'm sure Dr. Gayles will provide more specific numbers, but the numbers that we're seeing through our EMS system are actually increasingly alarming. 20% of the calls that we received on Monday met the definition of being PUIs, or persons under investigation for COVID. That is one of the higher marks that we've seen. That's 1 in 5 EMS calls meets the criteria, and that's a pretty significant number. Resuscitations and other things are up as well that lead us to believe that we may see some increasing numbers in our hospitals, and that tends to follow through over a protracted period of time with increases in long-term consequences, including mortality. We have a few things that we want to talk about today. So first off, enforcement. We're increasing our enforcement. We continue to do so. We've actually integrated now our Office of Animal Services, our Department of Housing and Community Affairs. They've been trained up and are beginning to conduct in parallel with our existing alcohol beverage service and HHS resources, additional inspections of restaurants and retail and anything of the like that needs to be inspected, private property, parties, and other things like that as well. We launched a new resource yesterday that we sent out a press release on. It's a new food resource. It's actually an online portal where residents in need of food assistance can go on directly, fill out some basic information. They're contacted within 1 business day by a specialist who will work through the information they provided and link them up with a food resource. That portal is available in 7 languages so that we can serve our diverse clients and diverse residents and make sure that they get the resources that they need. This is part of our continued effort to both recognize and appreciate the impacts of COVID-19, but hopefully this is a system that becomes more part of the way we normally do our business as a county and can support our residents for the long term. The last thing I will note, and I think this is probably the most substantive thing that I will provide, is that we did launch a new vaccine webpage today. You'll see it updated. It went live about an hour, maybe about 45 minutes ago. So one of the big key features that you will see on that website is the option to sign up for alerts for vaccine updates as they become available. To be clear, this is not a link to sign up to receive the vaccine specifically, but it's an informational link. So our intention is on a weekly basis to be able to say, this is how many doses we gave out to these particular groups in the past week, and here's what we're expecting to be able to service next week. And so it also, the website itself gives some additional information around, where we're at, where we're going, and it also provides a great level, more detail that you're going to see that Dr. Gayles is going to talk about in terms of the vaccine priority groups and who falls into what group and how we've sort of tried to stratify even within the various groups, who, what, when, where, why of the order. And so I think our residents will find that helpful in describing sort of where we're at and where we're going. And we're hoping that as we get more certainty around the vaccine quantities, that we'll be able to give more informed timelines moving forwards. And that's really what the alert process will be all about, is to try and give people a heads up as their category that applies to them begins to come closer. They'll know because they'll be tracking it on a weekly at least basis. So that's all I have today, and happy to turn it over to Dr. Gayles.
Good afternoon, everyone, and Happy New Year. Always a pleasure to be with you all. We'll go through this and happy to answer questions at the conclusion. Before we get into the formal presentation related to vaccine information, there are a couple things I wanted to highlight and emphasize. First, as the county executive and Dr. Stoddard mentioned, we are continuing to see elevated numbers and elevated community transmission. The county executive relayed to you where we stand in terms of our test positivity measures and case rate measures. And while we are below the state averages, we still are running significantly higher than where we were at earlier phases during the pandemic. And this is further evidenced and concerning when we look at our hospital data. As Dr. Stoddard mentioned, 20% of our transports over the last several days have been folks with conditions concerning for COVID or COVID-like illnesses. In addition to that, we have seen that 4 of our 6 hospitals are in the red zone, so to speak. 2 of the 6 ICUs are at capacity in terms of staffed bed capacity. Unfortunately, at this time, none of the hospitals are reporting any acute bed care issues, or not issues, I'm sorry. None of them are reporting any they all have some vacancies at this point to be able to serve patients, but that number is dwindling quickly. So we want people to understand that, yes, we are talking about the vaccine. Yes, this is a potential light at the end of the proverbial tunnel, but we cannot stop doing what we're doing to keep people safe. And we do need people to continue to adhere to the guidance that we've put forward so that we can hopefully be able to move through all the different priority groups to get effective coverage and protection, so that hopefully sometime in 2021, we'll be able to return to some semblance of normalcy. I will also emphasize that even in the setting of vaccines, especially early on in the process, we need folks to continue to wear their face coverings and adhere to physical distancing and those types of practices. One of the first questions that I was asked when I received my vaccine approximately 2 weeks ago was, what are you going to do next? I told folks I'm going to continue to wear my mask and continue to adhere to the guidance that we put forward. Now, that also brings up an important marker. It has been approximately 2 weeks since I received the first dose of the Moderna vaccine, and I am doing well, I'm doing fine, and I have not experienced any side effects. So hopefully that will be, for the folks watching at home, hopefully that will be a point of encouragement as you move forward and that becomes available. Now, again, before we start the presentation, I would like to take the opportunity to say a special thank you. As the county executive mentioned, we have been able to put out a lot of vaccines in a very short period of time. And what compounds this is we are finding out our weekly allotment on the weekend before the week that we start. And so the team has had to stand up and build out clinic templates very quickly on the drop of a dime, and they have done so seamlessly. As at the completion of yesterday, we had distributed 94% of the doses that we had received in our initial allotments from the state. And we received additional doses on yesterday evening that we were putting out this week, which I'll share in a few. But I would like to specifically call out some individuals who are part of our team. There's obviously hundreds of folks who've been a part of the process, but in particular, Daisy Lucas, Comfort Panda, Cindy Edwards, Sean O'Donnell, Deputy Health Officer James Bridgers, Mary Anderson, Annika Telling, Rachel Knowles, Dan Schaefer, and a host of fire and rescue staff who supported us in these efforts, and Dr. Raymond Kroll. Now, I also would like to say a special thank you to the Montgomery County Medical Society, who has helped us in the early stages, notifying a host of providers, and have fielded a lot of questions as folks have called them. Now, I would like to emphasize, as Dr. Stoddard mentioned, there will be a new page going up on the county website that breaks down the concept of prioritization. It also provides more information in terms of how folks can connect to completing the provider survey that we ask folks to do so that we have their contact information. So when it's their turn in the queue, we can get that information out. And so I would encourage folks, as opposed to calling the medical society, as they have quite a lot of work to do on their own anyway, and have been great partners, to utilize the county resources and also contact the health department at 240-777-1755 for further questions. Now, with that said, happy to begin the presentation to the maestro controlling the slides. All right, next slide. So as I mentioned briefly, up until yesterday, we had received 2 allotments of doses. The first allotment, if you recall, was 100 doses on the week of December 23rd, followed by a second allotment received on last week of 4,200 doses. As of yesterday afternoon, at the completion of those clinics, we had administered 4,047 of those doses, which is approximately 94%. Next slide, please. On yesterday, late afternoon, we received an additional 8,600 doses. And as the county executive mentioned, this represents approximately double the doses we had received the previous week. And again, I want to emphasize, these are just the doses being delivered to the health department. These do not include the doses that have been sent directly to the hospitals and sent directly to the pharmacies that are working with our long-term care facilities for administration. Now, because of these doses, now again, I will clue you in, we found out about these doses late Saturday afternoon. And so as a result of that, we were able to try, to quickly stand up clinics for the rest of the week. We have brought on an additional community site in addition to the one we had last week. So now we have 2 community sites that we're utilizing. We're running both of them each day for the rest of the week. And our goal is to distribute somewhere between 1,500 and 2,000 doses each day. And so we estimate that by Friday, we will hopefully, at a minimum, have distributed approximately 5,500 doses to those folks who are eligible in the 1A criteria. Next slide. Now, the challenge is this would bring to, with this week's allotment, it would bring it to us to a total of 12,900 doses shared with the local health department. And again, based upon our estimates, we hope to actually be somewhere in the 10,000 range of doses administered. Now, the challenge is, as the county executive referenced, we are only finding out our next week's allotment at this time the weekend before. And unfortunately, the state only finds out their allotment from the federal government 1 week in advance. And so at this time, we have had to operate in terms of having what you can consider to be a shortage of vaccine. And as a result, we have had to create a prioritization framework, if you will, utilizing CDC guidelines based upon types of exposure, types of patients coming into certain areas, and the types of venues that may carry higher risk. Let me be very clear. Any prioritization algorithm that's put out by us or any other jurisdiction does not diminish and dismiss the risks that any provider may face and anyone coming out into public and being in a setting working with other individuals may face. But utilizing that criteria, we had to put in a framework to help get people through the queue, given and influenced heavily by the fact that we don't have an adequate vaccine supply at this time to cover everybody who is eligible. Next slide, please. So I wanted to clarify a couple of roles also between different groups so that folks at home understand this process. And I would also like to emphasize the reason why we're doing this now is the governor and the state had a press conference yesterday to lay out the state framework, and each health department is also having similar conversations now to move forward, as we were in some ways waiting for the state to make those announcements from the state level to ensure that we were working as closely and consistently within the state guidelines as possible. Now, within these early categories, the State Department of Health has been responsible for providing vaccines, again, directly to hospitals and sending those doses also earmarked for long-term care facilities through pharmacy partnerships. And so all of the long-term care facilities in Maryland have signed up with retail pharmacies to create partnerships so that the doses will be administered and handled and coordinated through those pharmacies directly to those entities. And from my understanding, the last conversation I had with state was that all of the nursing homes have been prioritized within that all of the nursing homes throughout the state will have received their first doses by the conclusion of next week. Now, the last category falls to the responsibility of the health department, and that is vaccinating all of the other individuals who fall into the 1A category. So our first responders, healthcare workers who are not covered and affiliated with hospitals and health systems, as well as those long-term care facilities. And when we look at the numbers, this number is anywhere based upon an estimate between 40 to 50,000 individuals who we have to get through the queue. So again, as point of scale, we've got about 40 to 50,000 people that qualify and meet that criteria. And to date, we've received 12,900 doses of the vaccine. Next slide, please. So with that in mind, we have created a framework in some sense of prioritization. Again, this is similar to what a number of other jurisdictions are utilizing, and in some instances have publicized. Baltimore City publicized a similar framework on yesterday and is available on their website. And ours will be available on the website that Dr. Stoddard mentioned in his opening remarks. And so priority group 1A, I'll go through these quickly as this information will be on the website to leave time for questions. Again, here are the groups that are covered within that category. Next slide. And we are continuing priority group 1A tier 1, and we're also all of the doses that we have administered so far in terms of the county apparatus have been a part of priority group 1A and tier 2. And this includes emergency medical responders, folks who are part of the vaccination team, testing team, the COVID response team, and we've prioritized primary care offices and urgent care offices with the understanding that if an individual is COVID positive, particularly if they're symptomatic, they're likely to seek care and treatment in those facilities in addition to the hospitals, either through the emergency room or if they're hospitalized, they would receive treatment there. Next slide, please. Now, this is the group, we're not quite there yet. Hopefully we will be there very soon. That includes other providers. Again, we recognize that there are other providers who are also at risk. And here's a list of those individuals who would fall into priority group 1A tier 3, including dentists, pharmacists, other healthcare professionals in outpatient specialties, in-home nursing staff, community health workers, optometrists, et cetera. Also moving further down into the first responder pool, including staff in our shelters, as well as our corrections facilities and other law enforcement. Next slide, please. And again, this is a continuation of other individuals who we would consider in the group 1A tier 3 group. And again, we are hopeful that we will be able to move forward and increase access to the vaccine in the very near future to these different cohorts. Next slide. Now, after this group, we would move to group 1B, and the tier 1 group within that is prioritizing adults who are over the age of 75. Next slide. Tier 2 would include other frontline essential workers, particularly those where they cannot telework. They are coming into frequent and potential exposure to others in their workspace and the public. And here's a list of individuals who would be included in that. Next slide. And then when we transfer over to 1C, the tier 1 group within that would be individuals over the age of 65. Tier 2 would be individuals who are ages 16 for the Pfizer vaccine and 18 for the Moderna vaccine to 64 who have different medical conditions that could put them at risk for a severe case of COVID-19. And that will be spelled out further, including a list of potential health conditions included within that consideration. And then tier 3 within that would be other essential employees who are not covered in the priority groups 1A and 1B. Next slide, please. So just want to reiterate why it's important to get vaccinated to residents at home is it protects you, it protects your family. It also, now the effectiveness of the 2 vaccines that we have available now are approximately 95%. It's not 100%, but the thought is that in the slim risk that you may actually contract COVID after completing the vaccine series, that you would have much milder symptoms, if at all, and prevent you from having a severe course of the disease. And we do hope that in terms of a time frame, that when this is made available to the general public, that we will have significant uptake upwards of 80 to 85% at least, that would provide fairly robust protection for our residents across the county, across the state, and across the nation, and that hopefully would give us the opportunity to be able to move forward to return to pre-COVID life. I would like to emphasize that the expectation is not for health departments and counties to bear the sole responsibility of providing vaccines to our residents. It is hopeful that as we continue to move through the different priority groups, that private providers will gain access to be able to offer the vaccine in their offices. And so there will be multiple places within which residents will be able to utilize and gain access to the vaccine. Next slide, please. And again, just to emphasize that even in the setting of a vaccine, we really need you to continue to adhere to the guidelines that have been put into place from early stages in the pandemic to mitigate transmission as much as possible. And that's continuing to wear your face coverings, continuing to minimize your exposure to individuals outside of your household, washing those hands, and maintaining physical distance as much as possible. Next, please. And that's the conclusion of the slideshow. We'll be happy to answer any questions that you all may have. Thank you.
Okay. All right. Thank you, gentlemen. And let's get started with Jordan Lindsay from IMC Media, who has a question for Dr. Gayles. Jordan.
Thank you so much for this presentation. Thank you for the virtual media briefing. So recently, the Montgomery County Board of Education advocated that all Maryland pre-kindergarten, grade 12, from pre-kindergarten to grade 12 educators be considered essential for the purpose of receiving a COVID-19 vaccine in phase 1B. I didn't know if you had anything to say in regards to that, Dr. Gayles, especially after your presentation just now.
Well, we actually agree locally, and we've included education staff in our 1B prioritization.
Okay. And what about children? We don't see many children getting this vaccine. Are they not expected to get it? How does that work when it comes to the vaccination and children and things like that?
Well, right now, the vaccines have been, the candidates that have been moved forward have been approved for individuals. The Pfizer vaccine has been approved for individuals over the age of 16, and the Moderna vaccine has been approved for individuals over the age of 18. And now they're conducting, clinical trials within those younger groups to be able to get the appropriate guidelines so that in the future, certainly we would be able to provide the vaccine to younger populations.
Got it. Thank you so much.
I would just add, Jordan, we actually met with MCPS leadership yesterday to talk through exactly what we are talking about today, which is that educators would be in tier 1B. We also have worked with them to begin for them to, they have roughly 24,000 MCPS employees. We've begun to ask them to stratify those employees based on their own risk, just as we're doing for every other category. And so, for example, the staff that are providing the feeding support through all the schools will be earlier than most staff, and the staff who are going to be asked to return to in-person education in the earliest phases of the MCPS return to school plan will be given priority as well. And so the school system is working through those priority determinations as well. And I would expect that that'll be a point of conversation for the board next week.
Got it. Thank you so much.
Thank you. Caitlin Peets, Bethesda Beat, question for Dr. Gayles.
Hi, good afternoon. I have a two-part question, but I'd like to kind of ask them one at a time. First, we're on the topic of MCPS. So currently, as you know, they have a plan to start bringing kids back into buildings in a phased approach starting February 1st. If metrics are met. But right now, we're nearly 3 times the threshold of the case rate per 100,000 people that they've set, to start that. We're above the 5% test positivity and things are trending in the wrong direction. I'm wondering, do you think it is reasonable, based on where we're at and what you're expecting moving forward, that the metrics that MCPS has set, the case rate of 15 per 100,000 people, the 5% test positivity rate, could reasonably be met by February 1st?
I think it's going to be challenging to reach it by February 1st. But as Dr. Stoddard mentioned in our conversations with him, we've also talked extensively about the opportunities that would be presented once we're able to get a significant number of teachers and staff vaccinated for additional protection and coverage. And that would alter the landscape where, as it currently stands now, those numbers are alarming. They're still going to be alarming for those levels of community transmission. But if we have a significant percentage of the workforce who've been able to get access to the vaccine and get covered, that does maybe change the conversation a little bit in terms of, having a discussion about what those particular metrics look like in the setting of fairly, widespread access to the vaccine amongst those who would be participating. So I think that what I would say is that I know that the state will continue to engage in conversations around this topic because our jurisdiction isn't the only one who is above the metrics that a lot of local school districts have set forth to come back to school, as well as the state guidelines. And so I would say be on the lookout for some continued engagement and discourse for that topic at the local level as well as the state level over the next several weeks.
And this isn't my second part of the question, but you raised a point that I want to clarify. Do you think that the county will get to the phase where that includes educators by the end of the month, like Governor Hogan said is suspected for the state?
I mean, obviously we hope so. I mean, we hope to move through this quickly, but you know, to just emphasize, we really are at the mercy of what allocation we'll get from the state. And as it currently stands, you know, we're finding out the weekend before. So it makes it a little bit difficult to, you know, forecast that out. But I will emphasize this is that, you know, when folks are looking at the numbers to say, okay, well, are you going to wait until you've confirmed that you got 50,000 people vaccinated before you move to the next? We're not going to do that. You know, we're going to try to move forward and look at the trends in terms of people who are coming in and signing up. And if there are spaces and opportunity to expand quickly and to increase access to folks, we will try to turn that around quickly and make that information known to the public. And so I know that there are folks at home who are frustrated. We've seen the emails, we continue to get the emails, but I help folks understand we're also working very quickly once we get information and once we get supply in to turn that out quickly and get it out as quickly as we can.
Okay, and my last question for you. So based on what we have just discussed and kind of where we stand as far as the metrics go, would you advise the school district to begin its transition to the hybrid model on February 1st, or would you advise that they remain fully virtual?
I think what I would say is we're going to continue to have conversations with them. I do not think by February 1st that we would see you know, at a minimum is that we would see folks getting their first doses. We wouldn't see a significant swath of those who are educators and staff having completed the process just based upon where we are. But I look forward to, as always, we will continue to study the literature and look for best practices. We'll continue to engage with our colleagues at the state as well as across the country to see if there is room at all, you know, to tweak the advice and guidance that we've given so far.
Thank you.
I would only add to Dr. Gayles' comments. I think that this goes to the same. We are committed to trying to get kids back into school. We are very interested in having that happen. The literature does seem to indicate right now that while children seem to be at a lower risk than the community transmission level might indicate, the educators and staff do not seem to fall into that same, you know, they aren't as protected. The data out of England this week suggests that they are actually seeing higher levels of staff and educators infected than the average population. And so at best, the data is mixed as it relates to the entire school environment. Children may be lower risk, adults in the school systems may be higher risk, but we are committed to getting children back into school. And by vaccinating the adult staff, the educators and staff and others who are in the schools with the children, we, as Dr. Gayles said, we may be able to evaluate the recommendations that we make and consider a slightly higher level of transmission if it's in the context of vaccinated staff and teachers. So I think that we're interested in getting there. The school system's interested in getting there. We want to make sure that we're going to be able to protect both the staff and faculty as well as the students.
Thanks.
Thank you. Gina Portnoy, Washington Post, has a question. Gina, you need to unmute. There you go.
Hi, sorry about that. My question is about the surge in hospitalizations and new cases. I'm curious if you attribute this to a Christmas holiday surge because of gatherings during Christmas. That's my first question.
Well, I do think we have seen a surge of cases following the Christmas holiday. For example, if you give me a second, I'm pulling up my new case chart here. When we look at the red cap data, our highest, as far as I can recall, our highest daily total of cases based upon the day that they were drawn is from December 28th, where we saw 605 cases, positive cases that were drawn on that day. followed by December 29th at 519, December 30th at 558. And then on the 31st, we're still continuing to get data and information. So based upon that, we do see a blip up of cases following the winter holidays. And we'll continue to monitor to see if we see any difference and any further differences in terms of the new cases. But again, as Dr. Stoddard referenced and I mentioned, we have seen an uptick in hospital cases since the end of 2020.
Okay, you mentioned the so-called red zone and ICUs being at capacity in terms of staff. How are hospitals managing with that, and what are the next steps as if the numbers continue to increase?
Well, I'd also like to say a special thank you to the hospitals because they are managing and working as nimbly and quickly as they can to make sure that they're continuing to meet the needs of their patients. So they're exploring all sorts of strategies related to staffing to be able to recruit staffing from different places through different agencies, pulling from across the country. Again, part of the challenge this time around is that in the early stages of the pandemic, not as many places were hit as hard as we were or some other places. So we were able to recruit and pull more easily during that time period. Right now, we're seeing a majority of jurisdictions hit hard. And so it makes it a little bit trickier. From a space capacity standpoint, we do have room to grow in terms of the facilities. They have been working with, I know they've been working with each other and working with other hospitals across the state and across their health systems to be able to transfer patients to other facilities that may not be at as high a rate of capacity. So that's what they're working on right now. And the goal obviously is, from our perspective, the public health side of things is to do what we can to prevent people from having to show up to the hospital anyway and ultimately utilize those beds.
Okay.
I would also add to, I think one of the big things that we're seeing from across the country is, and particularly in LA County, is that you can have surge capacity, you can increase the acuity of the beds in the hospital setting, but the facilities themselves are not designed to have every patient in a hospital setting operating off of things like oxygen, for example. And so there are hospitals in LA County that are now concerned that their oxygen systems are incapable of supporting the number of patients in the hospitals that need oxygen. We have not seen that in Montgomery County, and I believe that in part some of the actions, but the responsibility of our residents relative to what we're seeing in other parts of the country is higher. I think our residents deserve a lot of credit. So the actions that we as a county and our neighbors and the state have taken to curb some of the activities has blunted some of the impact that we believe we would have seen more of in travel. We saw a huge spike after Thanksgiving. It was not as bad as it could have been. We saw a spike after Christmas and New Year's. It may not have been as bad as we think it could have been because of the other actions that were taken. And so I think we're trying to get a better picture of exactly what the spike that we're going to see is over the next, so sort of 2 weeks as we, clear the holidays and give enough time for the whatever is going to have spread over the holidays and what the testing structure takes to catch those things, to understand exactly what that new peak looks like. But I think we're not happy about where we're at, but we're optimistic that we're not going to potentially blow out the system in the way that we were really concerned about a month ago.
Okay, next, Chris Gordon, NBC4, question about vaccination.
Yes, thank you very much. I think the county executive said it earliest that you've been deluged with questions, and we're trying to make available the information of when the different groups will be able to get vaccinated. Is that what your website, the information that will be on your website, if you will make clear where is this website so we can publish it, and what people will learn and what they won't be able to do, which I guess is to sign up. They can register in some way though and get alerts. You were talking about that. Want to make sure that we get out. And also whether you're going to be using the National Guard. Those are my questions.
I'll answer the last part quickly and then shift over. Dr. Stoddard can give more information about the website. So yes, we anticipate we'll be utilizing the National Guard to to help support the current existing clinics we have. But for the folks at home, again, trust and understand that we are already mapping out how we can scale up even more, utilizing county sites, as well as we have ongoing conversations with a number of community provider partners as well to be able to expand the scope and satellite and scope of options we have available in potential satellite spaces. But yes, we hope to get access to the National Guard, and we will put them into action.
So I believe that our trusty pilot is showing you the website on the screen right now. As you can see here in the red box, the highest red box here, you can click on that link and that shows you where you can sign up for the email and text updates. That will, it's a quick process where you go in and provide how you'd like to receive the information. You provide the necessary information to get subscribed, and then now you'll receive the regular alerts. As far as the rest of the page goes, and I think we can go back, and so we really tried to update a lot of this information, and you can see here in the yellow, this is the survey location where Dr. Gayles has alluded to, where providers can go to and provide their information, which then they'll, when their priority comes up in the list, they will receive a notification and a registration link to get registered for their vaccine sites. This portal's been up and running for a little while now, but anyone can really go through it. You'll be placed in the queue at your appropriate time based on the phases, which I think we can show you here in a second. We'll go back to the main vaccine page. Up the top right corner, scroll up a little bit on that. See the C phase 1 priority group details. Click on that link right there. This shows us where we're talking about right now. These tiers that Dr. Gayles previously described in the slides. You can see we're in priority 1A. We're currently doing tier 1 and tier 2. You can see what's included in those tiers. Our hope is that over the coming weeks, let's say hopefully a couple weeks, we'll be able to move on to tier 3, and we provide all the definitions of as much details as we possibly can on who's included in each of the tiers of this list. And so you can see, and we give a little bit of an explainer of why we've stratified this way. We're not suggesting that dental practices aren't at risk, but as Dr. Gayles alluded to, most dental practices in Montgomery County are saying if you're symptomatic, don't come, whereas the people in tier 2 don't have that option. Those are the people to whom you are going if you are sick. And so that's the key point here. And so so basically all healthcare workers are in the top tier. We've just stratified those out so that we're making the best use of the vaccine possible. We also provide some information about the CVS and Walgreens partnership and what they're vaccinating for. We go through into our later tiers. I think the key thing to say here in our priority groups is, and Dr. Gayles sort of alluded to this as well, some of this will become updated over time as we get more information. So for example, in category 1C, the medical conditions, it's very likely that list could get updated over time, and we'll have to be prepared for that. But this gives as much information as we have right now on who falls into what category and what their conditions are for that. So we're going to continue to add to this page as we get more information, but this obviously is our current best effort to try and get as much information about what we currently have available to us, who's currently eligible. And as we get more certainty about the rate at which we're going to see doses come in, we'll be able to potentially give some better projections on the timeframes in which we may be able to move to various categories. So I think that's hopefully helpful. We definitely encourage people to sign up for the alerts and visit the website with frequency, and we'll continue to keep it updated.
And I just wanted to make sure I understand, what is the website how that we should publish? And I also understand from Dr. Gayles, in terms of the time, you don't know. It depends on what the state allocates, and you get that information weekend before, if I'm not wrong. So
that is correct.
If I want to publish this website, is it Montgomery County government /
COVID-19/vaccine?
Yeah.
Yes, Chris, thank you. Yeah, and so what our goal is, when we send out these notifications, for example, we'd like to, plan on like Fridays, for example, let's just say, we'll talk about how much we were able to get out during that week, who we got it out to, and then hopefully be able to say next week we'll have this many doses and we're going to move on to this other tier, and that includes these people. That way people can sort of be 1 week ahead of, they'll be able to track based on our website here what the order is, and they'll be able to see exactly where we are in our distribution scheme to know when their name may be coming up on the list.
Thank you.
Thank you. Appreciate everyone helping us get this message out there.
Thank you. Randy Bass with WDVM has a couple questions.
Good afternoon, everyone. Thanks for having me on the call this week. One question that I've been asked by some of our viewers is, once we get to some of those later tiers and eventually into general population, how is the county planning to target messaging and reach out to particular groups that may be hesitant when it comes to getting the vaccine? I feel like a big part of this battle is going to be getting people to get the vaccine. Some people I've talked to say no way, and other people I've talked to are ready when the time comes.
So there are multiple efforts that are going on behind the scenes to address that, just that. And in fact, the folks who are coordinating this press briefing right now are very intimately involved in those efforts and in working with numerous county government partners as well as key stakeholders within the community. And so I'm not sure if all of those efforts are ready to become prime time, but I can assure you that everything that you just expressed in your question is of great concern to us as well, and is being worked on to proactively address, so that when folks do get to the point where it is open to the general public or it does hit their particular priority group, that there's been an opportunity to proactively address their questions and hopefully diffuse some of that anxiety and concern and encourage them to get the vaccine.
A follow-up to that, I've spoken with several hospital systems in the county. They've told me that some of their employees are opting out of the vaccine, somewhere between, at one point it was 20%, but it sounds like some of those numbers are starting to go down. What do you say to people who are turning down this vaccine once they've had the opportunity to get it? And what would you say to encourage people who may have the chance coming up very soon?
Well, I think the most important thing is to actually take some space to have an opportunity to understand what their reasons are for their reluctance. I think, it would be faulty to assume that it's like, hey, you need to get it because it's great, as opposed to saying, all right, let's find out what it is that's driving that decision. Because it could be something personal, it could be something that is rightfully rooted in a historical perspective. And I think once we can gain a better understanding of what those different reasons are, we'll be able to, provide specific guidance. In general terms, for those, not breaking that down, but in general terms, I would say to folks, which is why we've tried to be very public about, my experience getting it and other people's experience getting it, is to say that really this is something that is routine. We understand that, in comparison to previous vaccines, things moved quickly. That doesn't compromise any of the safety around the vaccine and the efficacy around the vaccine. And again, I got it 2 weeks ago. I haven't grown a second head. I haven't magically shrunk or grown 6 inches or had anything crazy happen overnight or in the last 2 weeks. And the more we can routinize the experience of getting it, that follow up, and hopefully be able to, share that information, people will be encouraged. I'll be perfectly candid. All of my family members are like, we're going to wait and see what happens with you. How was your experience? And, I've tried to share that on social media and in my networks. And I've had a lot of people say, well, if you got it and you did okay and you endorse it, I'm good with it. And so hopefully as this continues to move through our communities and through those priority groups, there will be key stakeholders that people look up to and they listen to, who will have an opportunity to get it, to be able to spread that message within their communities.
Thanks so much. Appreciate it.
I would also add that we're going to be adding thousands of people every week. So for example, we're going to be having, demonstrating that this is an effective vaccine as we add people who are vaccinated. And so I think part of this will be multifold. So we're going to have to, obviously, I think Dr. Gayles was exactly right. We've actually met with some psychologists to understand sort of, why people may be willing to, or not willing to take the vaccine. And I think one of the key messages that we received is that different people will have different answers to why they don't want to take the vaccine. And we've got to address them individually, the rationale that are being used there. But I think one of the biggest confidence builders will be simply rolling out this process in an efficient way, have people receive the vaccine and have them not receive or not have any of the side effects that people are concerned about having. And so we're going to be hopefully adding, thousands and hopefully soon tens of thousands of people every week to the list of people who've been vaccinated, and we'll be able to demonstrate firsthand to those people. And I think as sort of the governor alluded to, and we've actually been using similar language, so we were pleased to hear him use it. We're very much using what I think he referred to as like the Southwest model, whereby people in 1A are going to come on board, and as we are queuing people up, as we start to see a diminishing number of people in 1A wanting to be vaccinated, we'll just start rolling in phase 1B. So there will always be people ready to receive the vaccine. That doesn't mean the people in 1A in 2 weeks or 3 weeks who finally decide that they want to get vaccinated are going to be, you've missed your chance. They'll add into the queue with the other people. And so we'll be able to continue to build up our vaccination effort over time, even if there are people in various categories who are concerned about receiving it.
Thank you so much. Really appreciate your answers.
Thank you. Next, Kate Ryan, WTOP, questions for Dr. Gayles and also for Dr. Stoddard. Kate?
Well, thank you so much. I appreciate that. I wanted to start with Dr. Gayles in terms of numbers. When we talk about educators, what kind of a cohort does that introduce into the process? And we were talking earlier about the governor said he hoped to start by the end of the month, by the end of January. The hope was that they open schools February 1st. Do you have a possible target date for how long it might take to get teachers vaccinated, to get back in the classroom? And does that have to be the 2 dose? Could they go back into the classroom after 1 dose, or would you recommend that not happen until they get the 2nd dose? And then I have a follow-up for Dr. Stoddard.
Okay, thank you for your question. So I'll answer the second part first. I don't think we as we referenced, I think there's going to be a lot of conversations that are ongoing to discuss the parameters about return to school in the setting of a vaccine. I don't think any of us are ready to comment on a magical number to say this is the particular way that it will go. But I do know that those conversations have begun and they will continue. And again, they're not just here at the local level, they're also happening at the state level. And as always, from a local perspective, we do welcome when there are state guidelines and state input that will help, to help the local jurisdictions make those distinctions. So stay tuned on that piece. As it relates to numbers, as Dr. Stoddard mentioned, we meet on a regular basis with our colleagues at MCPS. And one of the topics of discussion yesterday was what potentially would a rollout of vaccine look like in their population. And when you're talking about the broader MCPS community for teachers and staff, I think that's a much larger number. I think it was quoted somewhere between 40,000, 24,000?
There's 24,000.
Okay, 20 to 24,000. I'm sorry. So 20 to 24,000 staff for the whole system. Now, that could look a little bit different, as we've referenced in terms of prioritizing staff and teachers. So for example, the return to school models that MCPS has put out has put a priority on elementary schools and services for special populations. And so even in the absence of getting the entire system covered, there is thought that you could potentially start with a prioritization group based upon those schools and classes that would be going back first, and ensuring that all of the staff and teachers that are associated with those venues are covered first, and then being able to move through the queue with the rest of the populations to match up in terms of their return to school metrics. But none of that's settled out right now, so I would say stay tuned. It's an excellent question, and I look forward to being able to get more information to be able to provide some guidance to that process.
Thank you. I appreciate that. And for Dr. Stoddard, in terms of, and we've talked about the reluctance or hesitancy that some groups may have, this is anecdotal, it's from other jurisdictions, but I wonder if you're seeing it here among paramedics and firefighters. Are you seeing any reluctance at all? And then on the 20% of calls that they've brought in that may be COVID related, is there anything novel in that population regarding COVID?
I think the short answer is yes. We have seen some hesitancy amongst the initial cadre of EMS providers. I don't know that we have a final number because they're actually they're included this week. So I think we got about 900 vaccinated last week, and we have about when we include all first responders, about 6,000. And so we did it by sign up, right? So people filled the slots, and so we don't know how many who didn't fill the slots or were essentially refusing to. But we believe it's probably maybe 40% or more who are going to have some concerns. But even in surveying that our fire rescue team have done for their staff, they basically had, there's a range. There's some people who are saying, I don't want to get it. There's some people who are saying, I'd like to see other people get it before I get it. And so there is hesitancy, but it's not necessarily, not all hesitancy is outright refusal. And we're still working through some of those things. And as we have better numbers, I'm sure we'll be providing them. But we really expect the real bulk of we've done some of the EMS providers so far because they'll be also helping do vaccinations. So we're going to hopefully have by next week starting to roll out to a broader array of our public safety partners through, Fire Rescue is actually going to be taking on a big leadership role in getting the public safety teams vaccinated. And so we should have a better idea of where that hesitancy level actually really is next week.
Got it. And again, on the people who are coming in on these COVID-related calls, is there anything novel? Is it a different population, or is there anything different about?
I'd have to look more at the numbers. Nothing was relayed in the report that was given to us that they said the things like they track things like apoxia, which is basically people who need to be put on some form of oxygenation, even in transport. And that number was like 25%, which they understand where their statistically significant variance is from day to day and from month to month and all those things. And so they're really looking at deviations from the norm in terms of the statistics they see. And the things that stood out to us when we got the report this week was that there was such a large increase in the number of people who met the criteria for COVID. They weren't COVID positive necessarily. It means that they had symptoms consistent with COVID and needed supports from EMS consistent with COVID. But it could also include flu or other respiratory illnesses as well, just because the symptoms, particularly at those, at that level of scrutiny, look very similar. And so there was nothing in those numbers. We are seeing an increase in the number of transports from our nursing homes and other specialized nursing facilities. We are seeing increases in the apoxia, I think, as I referred to, and just the overall call volume was several standard deviations above what the normal call volume was. So even the high percentage was embedded within a large call volume. And so I think those are all things that sort of were flags for us within our EMS network that give us, they're sort of bellwethers, because obviously EMS is a portion of what shows up at the hospital. But, when we see those kinds of things, it makes us concerned. And that's why we talk about, we've often talked about the complexity of the COVID-19 data, why we can't just point to one number that may concern us. We're looking at EMS data, we're looking at hospital data, we're looking at the test positivity, we're looking at the number of cases, and that's why it's sort of an additive thing. I think we try and point out when particular categories raise concerns for us, and this was one that we stuck out to Dr. Gayles and I both independently. We could talk to each other about it, and it's sort of flagged as unusual that we are this high.
Thank you very much. I appreciate it.
All right, and we have one last question coming in from Fox IDC, Ike Yoki. Ike? Unmute if you can, Ike.
There we go. Thanks. This is for Dr. Gayles. Happy New Year, everyone. First things first, we're having reports of another potential possible outbreak at Shady Grove Nursing Facility. Being told 27 residents are positive for COVID-19, including 2 staff members. They're having a wing that is currently underway. Can you just talk to us a little bit? Is this another potential outbreak?
I don't have any information to share with you at this time. I'll look into it and be able to get back to you, but I don't have any further information to comment at this time.
All right, that's all I had. Appreciate it.
Sorry.
All right, and with that, we're done with the questions from the members of the media. Going once, going twice. Thank you, everybody, for joining us, and we'll see you again next week. Have a great afternoon.